You're welcome to my channel. This is looking pretty good, right? But I'm not going to talk about food or send this to you. No. It's all about someone with diabetes mellitus, but on a particular medication called beta blockers. What is likely going to happen? Let's go. For us to get the understanding properly, let's briefly talk about hypoglycemia or hypoglycemic unawareness. If you're familiar with this, great. In this situation, someone with diabetes mellitus, probably because he or she is old, the diabetes had been in the system for a long time, chronic condition, taking alcohol, or had undergone certain surgical procedure, or there's neuropathy somewhere, and maybe because the brain is already adapted to the low level of sugar, the unawareness here is that the person will not feel the signs and symptoms of low level of sugar. And it could be as a result of the use of certain medications. In this case, beta blockers. Anyone on beta blockers and is diabetic, and you are treating hypertension in diabetes with that, although the expectation is we use ACE inhibitors, and if there's reaction, you use angiotensin receptor blocker. But if peradventure you have been given beta blockers and you are diabetic and you're on treatment and you can't sense when you have low level of sugar, then this is for you. Beta blockers on its own will increase the rate of hypoglycemia, low level of sugar. There are other side effects associated with beta blockers. And another issue is when you are treating hypertension, you have to be careful because you could be treated to hypotension. You have diabetes, you're on treatment, you can run into hypoglycemia. Unfortunately, signs and symptoms of hypotension and hypoglycemia can overlap. So, in this case, somebody is on beta blockers for any other reason, or for hypertension, or for anything in diabetes, that beta blocker can mask the early signs of hypoglycemia. Now, you have high level of sugar, hyperglycemia, and you're on treatment. Note this. Hypoglycemia is the main complication of therapy in diabetes mellitus. That does not mean that is the only one, but the main one. And why that? Hypoglycemia is more deadly than hyperglycemia. Let's go to some blood glucose levels and what the natural response will be. When the value of glucose level is around 4.4 millimoles per liter, the expectation naturally is that insulin secretion will drop. When the value drops down to 3.9 millimoles per liter, certain things will occur. There will be release of counter-regulatory hormones. Then we have glucagon, epinephrine, norepinephrine, growth hormones, cortisol, ACTH. When that has happened, with the availability of those hormones, then insulin production is already halted. We can be rest assured that more glucose will be pumped into the circulatory system. So there will be gluconeogenesis. Then peripheral use of glucose will also drop. And what is our gain? Hypoglycemia will be corrected and further drop will be prevented, and the life continues as if nothing has happened. This is the expectation under normal circumstances. But if for any reason we lost the natural regulatory mechanism the counter-regulatory hormones are not helping enough, or for what other reason or reasons, the glucose level drops up to the level of 2.8 millimoles per liter, then we'll be faced with adrenergic symptoms. If there is no correction with adrenergic symptoms, then the value of glucose will drop further. And when we reach 2.2 millimoles per liter, then we'll be faced with neuroglycopenic symptoms. So one will occur before the other. Adrenergic before neuroglycopenic. Now, even at the level of neuroglycopenic signs and symptoms, if not adequately handled or corrected, and the value drops further to 1.1 millimoles per liter or lower, then we are sending the individual to a comatose state and, of course, the end of life. Now, blood glucose response at the level of 2.8 millimoles per liter. What are the adrenergic symptoms? The symptoms at this level will be palpitations or tachycardia. The heart will be racing fast. Your hand will be shaking, legs shaking, the whole body shaking, sweating profusely, can be having nausea. There might be tingling, irritability, hunger, or anxiety. At this level, when the individual is on beta blocker, then the adrenergic symptoms mentioned will be blocked. And the situation will not be corrected. And when it's not corrected, it will degenerate. It will degenerate, the level of glucose will drop further, and will be faced with neuroglycopenic symptoms. This is the danger zone. At 2.2 millimoles per liter or lower, neuroglycopenic symptoms will be here. And what will be the neuroglycopenic symptoms? The behavior of the individual will change. He or she will become confused, slow speech, there will be weakness or lethargy, difficulty speaking, might even have headache. There may be blurred vision. He or she could become unconscious, seizures, unresponsive, and could go into coma. And of course, if no correction quickly, rapidly, then the end of life, death. In conclusion, it is better to use another medication. In other words, it's better not to use beta blockers if you have diabetes mellitus and you're on treatment. Or if you must use beta blockers to deal with any condition associated with that diabetes, then one thing could be done. Increase the frequency of glucose measurement. If you have been checking your glucose maybe once in 2 days or once daily, double the frequency. Prevent hypoglycemia unawareness, so that the beta adrenergic symptoms that will herald danger will help us to act quickly, and we will not get to neuroglycopenic end of it with unconsciousness, coma, and death. With that, I've come to the end of this short presentation to enlighten us that someone with diabetes mellitus on treatment stands the risk of hypoglycemia, and we must know the signs and symptoms of hypoglycemia so that we can correct it. And the first phase will be adrenergic symptoms, which beta blockers can mask. They can block it. They can prevent us from having the first stage of the deadly hypoglycemic condition that could kill us faster than hyperglycemia. Thanks for listening. Remember to share this. I appreciate it.